Cancer care has advanced so greatly. Every year we are seeing new and new changes that are coming up. What do you think is the biggest challenge that we have today in advanced cancer care?
In this era of globalization with the advancement in technologies, we have data pouring in from all the sides. So patients or their attenders come in with all the data pertaining to cancer. Might it be related to longevity or treatment or outcomes or side effects, and they bombard us with all these questions. These are the main challenges that we see in our practice.
Yeah, I agree. I think on one hand we have information overload. There's so much of free information available on the net, and there are platforms, AI platforms in which you ask questions, you get a ready-made answers. So this kind of information overload is the biggest challenge to be able to handle and to be able to answer amicably to the patients and their questions. I think is one of the biggest challenges. There are newer technologies which we learn, newer molecules which you get updated about, newer technologies which I get updated about. So that is a challenge which we are ready for and we are learning. But to be able to, sometimes we are not able to compete against this chat GPT and other platforms which give too many options. So sometimes it is okay to tell the patient that this is the correct treatment, this is what is the right way to go about it, but we may not be able to say yes or no and answer all the questions that are asked, because those things sometimes may not be something relevant to our field at all. It's just something which comes up on air. So I think the biggest challenge is for us to be able to keep it to the basic and see the problem as it is and to treat it, and for the patient is to not get overwhelmed and not believe everything that in social media or internet has to say, and to understand that this is a complex problem for which an easy solution is there, as long as we don't complicate it by overthinking about it. Thank you.